All right, guys, today we're going to cover chapter 22, which is the reproductive system. So the reproductive system covers the primary sex organs, which are the gonads. They produce and house the sex cells. They're the testes and the ovaries. They produce sex cells, which are gametes. Okay, we have secondary sex organs. They provide the route by which sex cells unite. So in men, that's the penis, glands, ducts. They store and transport sperm. And in women, it's the uterus and the fallopian tubes, and they're the environment for a nourished, fertilized egg. So the male reproductive system really serves to produce, transport, and introduce mature sperm into the female reproductive tract. There's lots of different pieces that we're going to talk about. The penis and the scrotum are the external portions, and inside the scrotum we have two testes, the organs that manufacture sperm and produce the male hormone testosterone. The spermatic cord extends from the abdomen to each testicle. It's a strand of connective tissue. It also contains the sperm duct, which is the vas deferens, as well as blood and lymphatic vessels inside there. So you can see this arrow is pointing to that here, and this opens it up a little bit and shows you the vas deferens and the venous network inside there. Next, we have the testes. They're two small oval shaped organs that lie suspended in a sac of tissue called the scrotum. They generate sperm and secrete testosterone. So we have one here and one here. The medium septum divides the scrotum. We have the cremaster muscle here, surrounds the spermatic cord and the testes. And in cold weather, it contracts to draw the testes closer to the body for warmth. And also, if the body temperature is too warm, it drops relaxes and drops the testes away from the body. You usually want the testes to be a couple degrees colder than the body temperature. Otherwise, it can damage the sperm. So inside, what really happens here, so this is a look inside the testes. There's a series of spermatic ducts. They carry sperm away from the testes and out of the body. We also have fibrous tissue here that separates each testes into over 200 lobules. Also showing you there the seminiferous tubules, and that's where the actual sperm is produced. We're going to talk through a lot of the different things here. So first, the lobules. There's several layers of cells line the walls of the tubules. Each layer contains germ cells that have sperm in different stages of development. Also, Sertoli cells are there. They supply nutrients, remove waste, and secrete inhibin, which helps to mature sperm. And then lying between the seminiferous tubules are clusters of interstitial cells or Leydig cells, and they actually are what are responsible for producing testosterone, because that's the two functions of the testes, sperm production and testosterone production. The epididymis is what actually moves the sperm away from the testes into the vas deferens. So you can see here the sperm are going to move out through this network and into the epididymis. As the sperm move from the head to the tail, they mature. They can be stored in the tail here for about 40 to 60 days. If they're not ejaculated, they're disintegrated and reabsorbed into the body. So about 40 to 60 days, they can sit there and remain fertile. Here's just another picture showing you the vas deferens. So that travels from the tail of the epididymis up through the spermatic cord into the pelvic cavity, right here over the ureter to the prostate, and then behind the bladder here into the prostate. As it turns downward, it joins the seminal vesicle to form the ejaculatory duct here. So this is the seminal vesicle, ejaculatory duct. This whole thing here is the prostate. There are two ejaculatory ducts, one for each testes, and then the ejaculatory duct passes through the prostate and it all empties into the ureter. So this is where the reproductive system and the urinary system combine in men. This is showing you just again showing you the seminal vesicle, the prostate gland, and the bulbourethra gland, which we're going to talk through here. So these are the three structures here that we're going to talk about. The seminal vesicle, like we talked about, there's one for each testy, secretes a thick yellowish fluid into the ejaculatory duct. What it secretes compromises about 60% of semen, and what its job is really to do is it contains fructose to nourish the sperm and ensure sperm motility. So we have to make sure the sperm can get to the egg. The prostate gland encircles the urethra and the ejaculatory duct, secretes a thin milky fluid in the urethra to enhance sperm motility, compromises about 30% of sperm. And the bulbourethra gland secretes a clear fluid into the urethra during sexual arousal, serves as a lubricant, and also neutralizes the acidity of residual urine in the urethra. So it has two different jobs there. So let's look at the penis, okay? The body of the penis is called the shaft. The head is the glans penis, and the loose skin covering it is the prebus. What happens if we remove that foreskin? That's what a circumcision is, the removal of that foreskin there. So most men do not have that foreskin there. But if men do have a foreskin, we need to certainly know how to take care of it and clean the penis and always put the foreskin back. Here's what a transection view of the penis looks like. So we have 3 cylinders of erectile tissue that fill the shaft of the penis. During sexual arousal, the tissues fill with blood, causing the penis to enlarge and become erect. The 2 larger cylinders of tissue are called the corpus cavernosum. The smaller cylinder of tissue called the corpus sponginosum encircles the urethra. So these 2 are the same here, and then this one circles the urethra. So 3 different sections there. Let's talk a little bit about testosterone. That's the male sex hormone. Secretion begins at puberty. FSH, or follicle stimulating hormone, primes the spermatogenic cells to respond to testosterone and initiate sperm production. And LH, or luteinizing hormone, also called interstitial cell stimulating hormone, prompts the interstitial cells to begin secreting testosterone. Okay, so 2 different hormones there. Also, these hormones produce the secondary sex characteristics, so pubic, facial, and axillary hair, deepening of the voice, increased oil and sweat glands. So that's what happens when puberty happens. So let's see how sperm are formed. Spermatogenesis is the term for it. The ability to create sperm starts at puberty and continues throughout the life. Unlike for women, it ends at menopause. Sperm begin as spermatogonia. They're primitive sex cells located in the walls of the seminiferous tubules. Spermatogonia divide by mitosis to produce 2 daughter cells, each with 46 chromosomes. So they're identical. These cells then differentiate into slightly larger cells called primary spermatocytes, which move toward the lumen of the seminiferous tubule. Through meiosis, the primary spermatocyte yields 2 genetically unique secondary spermatocytes, each with 23 chromosomes. Okay, so we go from 46 to 23. Each secondary spermatocyte divides again to form 2 spermatids. Spermatids differentiate to form heads and tails and eventually transform into mature spermatozoa, or sperm, each with 23 chromosomes. So it's important to remember our sex cells only have 23 chromosomes. So when the sperm and the egg come together, they have a combined 46 chromosomes, which is the normal amount of chromosomes found in one cell. Here's a picture of a mature spermatozoa. The head contains the nucleus, which is packed with genetic material. A cap called the acrosome contains enzymes that help the sperm penetrate the egg during fertilization. So that's a specialty thing there on the head. The middle piece contains numerous mitochondria that supply the sperm with energy. And the tail, or the flagellum, is beats kind of back and forth, whips back and forth, and it's what helps propel the sperm forward and provides it with its motility. So we already kind of talked about semen, but just a refresher here. Semen is emitted during the ejaculation that accompanies orgasm. Semen is a whitish fluid containing both sperm and the fluid secretions of accessory glands. Each ejaculation expels between 2 and 5 milliliters of semen containing between 40 and 100 million sperm. Immediately after ejaculation, semen becomes sticky and jelly-like. This promotes fertilization by allowing the semen to stick to the walls of the vagina and cervix instead of immediately draining out. So there's some function there. The alkalinity of semen counteracts the acidity of the vagina, and this is important because sperm become immobile in an acidic environment, so we need it to be alkaline. And again, 60% comes from the seminal vesicles, 30% from the prostate, 5% from the bulbourethral gland. Let's talk quickly about the male sexual response, and we'll move on to the female reproductive system. So 4 phases here. Excitement phase. The parasympathetic nerves cause the arterioles in the penis to relax and fill with blood. Tissues within the penis become engorged with blood, and the penis enlarges. It becomes rigid and erect so as to allow it to enter the female reproductive tract. During the plateau phase, urethral sphincter contracts to prevent urine from mixing with semen. Heart rate, blood pressure, and respirations remain elevated. Orgasm is a brief, intense reaction, involves the ejaculation of semen. Ejaculation occurs in 2 stages. Emission, the sympathetic nervous system stimulates peristalsis in the vas deferens to propel sperm into the urethra. It also triggers the release of fluids from the prostate gland and the seminal vesicles. And then expulsion is semen in the urethra activates somatic and sympathetic reflexes that result in the expulsion of sperm from the urethra. Resolution occurs immediately following orgasm when sympathetic signals cause the arteries in the penis to constrict, reducing blood volume and decreasing the erection. So most of the male system is anatomy, a little bit about sperm development, and you definitely have to know the hormones, and then the male sexual response. So let's move on to the female reproductive system. The female reproductive system is a little more complex because it's more than just producing gametes. It's really in charge of carrying, nourishing, and giving birth to infants. And all of the organs are housed within the abdominal cavity. So here's a picture showing us the different areas. So we have the primary reproductive organs, or the gonads. They're the ovaries. They produce ova, which are the female gametes, or the eggs. And then we have the accessory organs, fallopian tubes, uterus, and vagina, going to the exterior. The internal genitalia are the fallopian tubes here, the uterus, the ovary, the cervix, and the vagina. So let's talk about those. The ovaries, like I said, are the primary. They produce ova and the sex hormones. There's 2 ovaries about the size and shape of almonds. They sit on each side of the uterus. Each ovary contains thousands of immature eggs. During a menstrual cycle, hormones cause one egg to begin to develop. Enclosed inside a bubble-like follicle, the eggs develop until at a certain point, the follicle bursts and releases the egg. That's known as ovulation. This figure here shows the stages of a single egg and follicle development. The ovary does not contain eggs in multiple stages of development. So this is one egg moving through the process. We're going to talk more about the ovarian and the menstrual cycle towards the end. So the fallopian tubes, they're about 4 inches long. They extend from the ovary to the uterus. The narrow isthmus is the portion closest to the uterus, here. Okay. The middle portion, the ampulla, is the usual site of egg fertilization. The distal end is the infundibulum, and then the fiambrae is this little wave-like projections that sit over the ovary. They actually kind of sweep back and forth to catch the egg that's released during ovulation. And because this isn't connected here, it's actually considered an open system instead of a closed system. The uterus is a muscular chamber that houses and nurtures a growing embryo. The upper 2 corners connect the fallopian tubes. Sits between the urinary bladder and the rectum. So the urinary bladder is in front of it, or anterior, and the rectum is posterior, held in place by this huge broad ligament here. The central region is the body, and the inferior end here is called the cervix. There's a little passageway here called the cervical canal. There's glands within the cervical canal that secrete thick mucus. During ovulation, the mucus thins to allow the sperm to pass. There are 3 layers to the uterus: the perimetrium, That's the outermost serous membrane. The myometrium is the thick middle layer. It's what actually contracts during childbirth. And the endometrium is the innermost layer where an embryo attaches. And also the upper 2/3 of the endometrium is what sloughs off during menstruation, or where the actual blood loss comes during menstruation. The uterus is actually tipped over the bladder in most women, and this part here is called the fundus. And as the baby grows, you can feel the fundus more and more of the uterus. The vagina is a muscular tube about 3 inches long. It's the receptacle for the penis and sperm. It has smooth muscle in the walls that allow it to expand greatly, especially during childbirth. It's a route for the discharge of menstrual blood and also the passageway for the birth of the baby. The vagina extends slightly beyond the cervix, creating pockets called fornices. This has a little indentation right there next to the cervix. The vaginal rugae actually are what allow for the expansion, just like we talked about bladder rugae. There's also the hymen, which is a mucous membrane that partially covers the entrance to the vagina. That actually can be ruptured during sex, tampon use, medical examinations, etc. Then we have the external genitalia. So we have the mons pubis is a mound of hair-covered adipose tissue overlying the symphysis pubis. Okay, we have the labia majora here on the exterior, the labia minora here on the interior. So the labia majora kind of cover the labia minora. The prepuce is where the labia minora and the labia majora meet to form a hood of skin. Usually covers the clitoris, which is a small mound of erectile tissue. We also have some glands in here. These glands are the lesser vestibular glands and the greater vestibular glands. So those sometimes give women some trouble. Oops. Then we also have the breasts. So on top of having internal and external genitalia and within the abdominal cavity, we also need to talk briefly about the breasts. Each breast contains 15 to 20 lobules separated by fibrous tissue and adipose tissue. Each lobule consists of clusters of tiny sac-like acini that secrete milk during lactation. Minute ducts drain the acini, merging to form larger ducts. The ducts unite to form a single lactiferous duct for each lobe. And then before reaching the nipple, the ducts enlarge slightly to form lactiferous sinuses. And then each duct ends in a tiny opening on the surface of the areola. A pigmented area around the breast, that's what the actual areola is. It encircles the nipple. There's numerous sebaceous glands there that help to lubricate the areola and prevent dryness and cracking during nursing. And then we also have the suspensory ligaments, which help support the breast and also serve to attach the breast to the underlying pectoralis muscles. So this is just showing like the pathway for milk, which certainly is part of the reproductive system because it plays such a role. I want to talk a little bit about puberty before we get into the ovarian and the menstrual cycle, and then we'll end our discussion on birth control methods. So puberty, we have gonadotropin releasing hormone stimulates the pituitary to secrete FSH and LH. FSH stimulates development of ovarian follicles. In turn, the follicles secrete estrogen and progesterone. Estrogen is responsible for female physical changes that occur, like breast development, adipose tissue deposits, and widening of the pelvis. Puberty starts a little bit earlier in females, about 9 or 10. First sign is usually breast development, then pubic hair and axillary hair, then menarche or menstrual period, and then ovulation doesn't begin usually until about a year after a girl has been menstruating pretty regularly. So the female reproductive cycle occurs in 2 different cycles. So you want to talk about these separately, but also talk about how they correlate to each other. So the reproductive cycle averages about 28 days in length. However, it can range anywhere from 20 to 45 days. Both cycles are controlled by the cyclic secretion of hormones. The ovarian cycle is governed by the hormones FSH and LH, and the menstrual cycle is under the influence of progesterone and estrogen. So the ovarian cycle, we're going to talk about first. At birth, we have about 2 million eggs. They reach an early state of meiosis before halting development. And by puberty, we only have about 400,000 eggs left because a lot of eggs degenerate during childhood. But most women only ovulate about 500 times during their life. So 400,000 eggs is usually pretty sufficient. So let's talk through what's really happening in the ovarian cycle. Low levels of estrogen and progesterone stimulate the hypothalamus to release gonadotropin releasing hormone. That stimulates the anterior pituitary to release FSH and LH. FSH triggers several of the follicles to resume development, beginning the follicular phase. Only one follicle will make it to maturity, however. The developing follicle secretes estrogen, which stimulates the thickening of the endometrium in the menstrual cycle, and it also secretes small amounts of progesterone. The follicle migrates to the surface of the ovary until it's ready. This is called the Graafian follicle. In the midpoint of the cycle, estrogen levels peak, triggering a spike in LH. The sudden spike in LH causes the follicle to rupture and release the ovum, which is called ovulation. The fimbriae of the fallopian tube sweep across the top of the ovary to catch the egg. The remnants of the follicle remain on the ovary and form the corpus luteum, which marks the beginning of the luteal phase. The corpus luteum secretes large amounts of progesterone and small amounts of estrogen. So this is opposite of what was happening in the follicular phase. The progesterone causes the endometrium to continue to thicken and become more vascular, waiting kind of for the fertilized egg to get there. High levels of progesterone and estrogen also inhibit the pituitary from producing FSH and LH, so no other follicles develop. If fertilization doesn't occur, the corpus luteum degenerates into inactive scar tissue called the corpus albicans. If estrogen and progesterone levels plummet, causing the endometrium to slough off, resulting in menstruation. When the decline in ovarian hormones occurs, the pituitary is no longer inhibited, so FSH levels begin to rise and a new cycle begins. So that's the ovarian cycle. We get the development of the egg, that's the follicular phase. We get ovulation prompted by a spike in LH. Then the luteal phase is what's occurring as the egg is waiting to become fertilized. If the egg does not become fertilized, this whole process starts over again. This also coincides then with the menstrual cycle. It's the first 1 to 5 days begin with bleeding. Okay, that's menstruation. This is the endometrium shedding its functional layer. Then we get the proliferative phase that starts about day 6. Rising levels of estrogen secreted by the ovaries stimulates the repair of a base layer as well as the growth of blood vessels. So this is stimulated by the new follicle that's being developed because the female did not get pregnant. So the ovarian cycle is going to start over. A new follicle is going to be developing. That's going to increase the levels of estrogen, which helps to repair the endometrium. The secretory phase, the endometrium develops into a nutritious bed about 5 to 6 millimeters thick. The premenstrual phase, if fertilization does not occur, the corpus luteum atrophies and progesterone levels plummet. Blood vessels nourishing the endometrium spasm, interrupting blood flow. The endometrium becomes ischemic and necrotic, causing it to slough off. Okay, so the premenstrual phase occurs after the egg is not fertilized. These are the two cycles together, which I think is a really nice picture here. So you can see what hormones are correlating with what. So here, this is what's happening in the anterior pituitary. Here's what's happening in the ovary. This is what's happening with ovarian hormones. This is what's happening actually inside the uterus. So here, the beginning of the ovarian cycle, okay, the LH and FSH are pretty steady. As the follicle is developing, it's secreting a lot of estrogen. As the estrogen peaks, it causes LH to peak, which causes ovulation to occur. After ovulation, the corpus luteum here causes an increase in progesterone, which helps to finish getting the endometrium ready to get that fertilized egg. If the egg does not become fertilized, estrogen and progesterone levels drop off, causing LH and FSH to be stimulated again, causing the cycle to start over. So these are the two cycles together. Quite a bit going on there, but we'll spend some more time on that in class. Last thing, one other thing I want to talk about before we talk briefly about birth control methods is the female sexual response. So again, 4 phases here. Blood flow to the genitals increase in the excitement phase. Breasts swell, nipples become erect and hardened. Greater vestibular glands produce secretions, and the uterus stands more erect. Plateau phase, the outer third of the vagina swells. The clitoris becomes highly sensitive. Orgasm, the muscles in the outer third of the vagina contract rapidly in series of pulses, and muscles in the uterus contract. Then resolution, the clitoris and the nipple soften. Vagina and the genitalia return to normal, and the uterus drops forward back into its usual position. So let's talk just very briefly about birth control methods. Surgical sterilization is where they cut or tie the fallopian tubes or the vas deferens, so the egg and sperm can't meet. The IUD is a plastic device that's inserted into the uterus. It's either copper or it has progestin in it. Causes inflammation that interferes with the sperm's ability to reach an egg. Can also thicken the cervical mucosa so the sperm can't even get into the uterus. These usually can stay in for 5 to 10 years. We have emergency contraceptive pills. They provide a high dose of estrogen and progesterone, and they actually prevent ovulation. Birth control pills are estrogen and progesterone. They inhibit FSH secretion and prevent follicle development. So 2 different things kind of happening there. We have Depo-Provera, which is an injection, usually given every 3 months. Synthetic progesterone, again, halts ovulation. And then we have barrier methods, which are female or male condoms. They block sperm from entering into the female reproductive system. Also, it's important to note that barrier methods also stop transmission of STD. The last one is the rhythm method, which is where people use a calendar or some sort of tracking mechanism to track ovulation and refrain from sexual intercourse 7 days before ovulation and at least 2 days after. But there's a pretty high failure rate with this unless people know their bodies very, very well.